Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. In our session today, we will collaborate with Divine Mercy UK to talk about uterine fibroids and its impact, particularly as it relates to Afro-Caribbean women or women of Afro-Caribbean background. And another important guest in this session is Dr. Daniel Adama. I got it right? Awesome. Who will share his knowledge and insight with us today to help us dissect this topic. So at this time, I will pass the virtual mic to our guests so that they can introduce themselves. I will start with Dr. Adama first, and I will then pass the virtual mic to Helen Crown. Thank you so much.
Hi, everyone. As introduced, my name is Daniel Adama. I'm a medical doctor. I'm currently in training to be an obstetrics and gynecology consultant. So I'm just in my second year of training. I live in Wales, Cardiff, happily married with a daughter and my wife. Yeah, I love singing. I love watching football and reading my books. That's basically all about me. Good to be here.
Okay, so we'll pass the virtual mic to Helen Crown.
Thank you so much, Joel, for having us on your platform. It's a privilege to be here this evening in UK time. And my name is Helen Crown. I'm the convener of the Divine Mercy UK platform as well, and I'm a student nurse as well. And what I do at the moment is I create awareness on health talk series on my page as well, creating an awareness on healthy lifestyle, and that's what I do. I've got a little one with me, and we live outside UK here. I don't need to mention. So that's what we do, and it's good to come on this platform this afternoon to talk about our view on uterine fibroids. Thank you so much for having us.
Thank you so much. And I do appreciate your time. I know that you are super busy. And I just want to mention, you talk about, we are in different time zones, but we are connected in some way because we do share, these similar issues. And you talk about, it's so very important what you do in that you talk about those health issues that impact our communities. And that's so very, very important. So very vital for sharing that information. So I'm really happy to have you on board to share with us today. And so before we begin, if you just join us, like and share this video, subscribe to our YouTube channel using the links on our page. We need your support to continue these talks. Also, if there's something that you think we should be talking about, feel free to let us know. We want to hear from you. With that, let's get into our talk. And so I know you talk a little bit about your background, but if you want to expand on that any more, feel free to do so. So I'll start with you, Ms. Crown, and then I'll get to Dr. Adama.
Okay, a little about my background is it was lately I joined the health area. I used to be an accountant before. I studied accounting from the preliminary stage, and where later I like to change into health areas where I gain more experience. I started with healthcare assistants before I just proceed for my nursing program. And since I've been there, I've been enjoying getting a lot of research about health-related topics, which I do bring to my viewers as well on my platform. And since I've been in that area, I've been enjoying it. It's good to let people know what is going on around the world, like creating awareness to people out there. So that's just a little background about me.
Thank you. Thank you. Would you like to add? Oh, go ahead.
Do you mean Dr. Daniel or me?
Yeah. No, Dr. Adama. You can continue, Dr. Daniel.
Oh, I thought
I interrupted you.
No, it's okay. It's okay. I thought she was about to say something more. Well, nothing. Life of a medical doctor is just quite boring sometimes. Nothing really more about my background. Finished medical school in Nigeria in 2013, and since then been practicing medicine. always had the passion for women's health, women's and child health. So I thought to go into training in gynecology and obstetrics to help throw more light into women's health and be there to help discuss things like this, provide solutions for women, because I noticed that these are things that are really, really neglected, and why not come in there and just help? Always wanted to be a doctor. My mom is a medical doctor, so it's just kind of like we grew up, medical family. So I had no choice to but to be a medical doctor. So that's basically more about my background. Yeah.
Awesome. Thank you so very much. So let's get into our talk, uterine fibroids. You want to know really what is it, for those persons who may not know what it means. Can you just, explain that to us? What is uterine fibroids, the condition, and how does it affect the body?
By way of introduction, uterine fibroids are benign growths. These are growths that are not cancerous. They are benign. In medicine, we call growths, abnormal growths, as either benign or cancerous. And benign do not have a potential to be cancers, but cancerous growths are growths that exponentiate and become cancers and could spread around the body. These are growths that are non-cancerous, but happen in the body. Now, they happen in women only because women have, biological women, I beg your pardon, they have an organ in the body called the uterus. Now, the uterus is the organ, one of the organs of reproduction, which is the organ which carries pregnancy. So virtually every woman, every biological woman will have a uterus, which expands when she gets pregnant and contracts when she's not pregnant. So this uterine fibroid, it's a disease of that muscle, the uterus, which takes baby. Now, it's a benign growth in that it doesn't transform to cancer. Rare occasions it might, but rarely. I haven't seen any reported lately. So that's what overall, that's the generic what uterine fibroids are. Abnormal growth of the organ of reproduction for a biological woman, which is the uterus. Now, it happens on the muscle layer. So the uterus, a woman has a uterus, it has three layers. The outer layer called the serosa, the muscle layer, which does the most bit of everything that the uterus does, and then there's an inner layer called the endometrium. So uterine fibroids mostly happens in the muscle layer. Now, this muscle layer, as you can imagine, a little organ which appears as a pear-shaped organ, could get big to get a baby. So what happens is the muscle in this layer are very smooth muscles, small muscles called smooth muscles, which can easily expand and contract back. So those muscles are the ones that usually have this change in growth and become uterine fibroids. We call them medically leiomyomas, but you don't get to hear that on the street. You just hear them as uterine fibroids. That's what everybody calls them. Yeah. Virtually, it's usually prevalent in about 40% of women overall in the world will have uterine fibroid. Okay.
Thank you for sharing that. Can you tell us how it affects the body, at least some of the ways in which it affects the body?
Sorry, before I go into how it affects the body, we classified them. So before you understand how it affects the body, you need to understand where they happen in the body, where in muscle layer they happen. If it's in the inner lining of the uterus, we call them submucous, and this will affect the kind of symptoms the patient will have. If it's in the muscle layer, it's called intramural. If it's in the outer lining, it's called the subserosal. Sometimes it could be around the cervix, which is the neck of the womb. Now, how does it affect the woman, or how can a biological woman know? The first rule in medicine is that usually she might not know that she has a uterine fibroid, and that depends on the size of the fibroid. If it's less than 4 centimeters, she might not know. Between 4 to 12 centimeters, a woman might not know that she has fibroids. One of the things that a woman might complain about, and you start to raise a suspicion of uterine fibroids, could be the amount of bleeding. She might be bleeding abnormally. So one is an abnormal bleeding. It might be heavy, or it might be in between her menses. Most Afro-Caribbean women usually will have heavy menstrual bleeding. That's really, really heavy bleeds. And then that raises suspicion that maybe she might have the uterine fibroid. Also, there are other things that happen. There are other organs in the body which lie very close to where the uterus is. So it depends on what symptom the patient presents with, whatever the patient tells you, or whatever the woman complains about. Then that raises your suspicion that she might have a fibroid also. Some people might have increased swelling of their belly. Okay, belly might just become quite big. She's not pregnant. It feels hard to touch. It feels like the consistency of the nose. It feels really, really firm in the lower part of the belly, just under the belly button downwards. If you press in there, and you feel kind of like a hard mass without pain and with a few other symptoms, then we could suspect that that patient could have a uterine fibroid. Some people, I think I said, find it difficult to get pregnant, and then we find out that they have fibroids, and that's what's causing them from not getting pregnant. Some people could tell you they have back pain, severe back pain, or pain during sexual intercourse. So these are things that could present to a woman, and you will make you suspect that maybe she has a uterine fibroid, and you need to investigate further. There are a few other things. I can list a few other things, a lot of things that might happen to the body, which a woman might present with, but the list is endless. So you need to sit down with the person and talk to the person and understand what the person's concerns are and what the person is presenting with, and then you can know exactly what's happening to the person.
Thank you. Thank you so much for sharing those, some of those, how uterine fibroids might impact the body. So I'm going to come to you, Ms. Crown. I don't know if you would like to add anything at this time.
Yeah, thank you so much, Bia. The cause of fibroid is unknown, but has been linked with a hormone called estrogen and progesterone. I know some of the common signs we know about uterine fibroid is the bleeding, which Dr. Daniel has mentioned. We used to have these common signs of bleeding heavy in women, like during menstrual pain and pain during sex as well, during sexual intercourse, constipation as well, pelvic pain, cramps on the legs, and so forth. So these are some of the signs that can give or someone to know that this is uterine fibroid. So these are the common signs that I know. Pelvic pressure at the back as well. So these are common signs that we need to know. And according to Dr. Dani, according to the research as well, fibroids in Afro-Caribbean women, has been like 3 times likely to occur in a woman, mostly in Africa, due to many reasons, which we'll be talking later as well. So these are the signs that we need to know about uterine fibroid. Thank you.
Thank you. Thank you so much for sharing that. For persons who may be experiencing that, I want to thank you for sharing that, because, you may have persons that experience those things and they may just, glaze over it, may not take it as seriously. But it's important to understand those signs so that you can, refer to your doctor as soon as, to determine whether or not it's really, that condition. So I want to thank you, Helen, and thank you, Dr. Daniel, for sharing that information. And thank you also, Helen, for talking about the prevalence in women of Afro-Caribbean descent. We're going to talk about that. So it is uterine cancer is more prevalent in Afro-Caribbean women, and if so, can you share why there's a higher rate of uterine fibroids in Afro-Caribbean women. I'll start with you, Dr. Daniel, and then come to you, Helen, if you want to add to that. Thank you.
Yeah. First and foremost, the cause of uterine fibroid, as Helen had said, was unknown. Okay, so we don't know. That's the first answer. There's lots of research to why women have fibroids, and then why do Afro-Caribbean women have it more than white or Asian women. We don't know. Lots of theories have come about, which are just quote theories. They haven't come out to establish any direct link to say this is why Afro-Caribbean women have it more than white women or Asian women. First and foremost, it's usually the reason why women have it is about the hormones, which she has said, the balance between estrogen and progesterone, which are the female hormones, dominant female hormones. Most times, some people say it's genetic. Okay, if your mom has had it, or your mom's mom, or your sisters have had it, the chances of you having it goes up, and that just happens because in Afro-Caribbean, our places, we have lots of women who have it. So definitely, because they have it, most likely it runs down in their genes that possibly the people, sisters or daughters could have it. Some people even say maybe it could be environmental. Could it be the weather? Could it be the sun? Could it be deficiency of something that we're not having? Could it be lack of snow? Could it be too much sunshine? And but still not proven. Like it's not really proven. So we don't know. Some people say that it's because of diet. Okay, there's some, Afro-Caribbean people eat a lot of meat, red meat, in terms of beef, ram, pork, and all that, and do not eat that much of green leafy vegetables. Could that be the cause? We don't know. It's not been established. So they're all theories, but nothing has been established. But one thing that we know is that hormones are usually attributed to having fibroids. And I wouldn't say that Afro-Caribbean women have more estrogen or progesterone than white women. But for something reason, we have about the same hormone level, but we don't know why we have it more than the white women. But usually hormones. And the reason why the hormone theory sticks more is that usually when a woman becomes menopausal, when she stops seeing her menses at about 50, 51 years old, we notice that fibroids shrink. How we treat fibroids by giving some medicines to induce menopause, fibroids shrink. So it means that the hormones are causative to fibroids. But why we have it more, Afro-Caribbean women, we don't know.
Thank you for sharing. Helen, would you like to add?
Yeah, said it all. The social conditions were part of why Afro-Caribbean women develop fibroids and at outrage size. And according to the research, it says the cumulative incidence, like Black women, 70% more than Black women, white women, 70%, while Black women have it more than 80% of women, Black do have it. And basically, I would say the stress, maybe like the stress of a lower quality of life in Africa would, cause why most of the reason why Afro-Caribbean or African people do have fibroids. And one of the things I will say he has mentioned is the vitamin D as well, which is the lack of sun, and which is the genetic predisposition, where often women, lack of sun and all the things. And another thing is the genetic reason, maybe like family history, maybe the mother has had, or one of the family in the past have had something related to that, so which can be a predisposition for that woman to have fibroid as well. So to say, like when they start having all this issue, as we mentioned, the signs and symptoms that do have this, like bleeding, these are signs that needs to be watched out for when someone have uterine fibroids. So thank you.
Yeah, just
Thank
just
you.
to add to that. So they've also I've read a whole lot about why Afro-Caribbean women have eat more than white women. They have looked at the genetics, they've looked at the gene, they've looked at the pigment, melanin, which is what makes our skin black. They've seen that is there a defect in that gene that has made us predisposed to having fibroids?
Yes.
And there has not been any link. So it's one of the wonders of medicine where we're still trying to find the reason. As you said rightly, it might be social economic quality of life that might
Right.
cause it, and the vitamins. But on the counter argument against vitamins is that you expect vitamin D to be high in where you have lots of sunlight. Okay. But fibroids is usually linked to deficiency of vitamin D.
Vitamin D.
So how do we have so much sunlight and lots of vitamin D, and then we're now having fibroids?
Do you know one thing, Dr. Daniel? I buy that
Yeah.
home and that research, because while I was researching for this, sometimes when we had this on my platform,
Yeah.
just the way you just said it, that the vitamin D and what's it called, the predisposition of this generally. A lot of Africa, if you look at it here in UK, personally, you see a lot of African women do prescribe what's it called, vitamin D tablet for them, and mostly a lot of us do have lack of weakness, anemia, so like iron tablets. And what are the reasons causing behind all these things are like a lot of people like African women have history of this fibroid, so all this from Africa background or like a family history or because of the journey you just mentioned and lack of that vitamin D. I noticed that a lot of us do prescribe vitamin D tablets and iron tablet, because in that area, when you get to know like 1 or 8 out of 10 women, that's African women here, as fibroid history. You see what I mean?
Yeah.
Wow, that's powerful. It's a mystery. It's very interesting. And so we get to our awareness and prevention. So we understand that, okay, uterine fibroids has an impact on women of Afro-Caribbean descent. But what is our level of awareness? And as a community, how do we create more awareness about uterine fibroids? And what are some of the steps that we can take? Are there steps we can take to prevent? Even though we don't necessarily know what causes the condition, how can we take steps to prevent the condition? So I'll start with you, Dr. Daniel, and I'll come to you, Helen. Thank you so much.
Well, preventing it usually will start from knowing the cause, which is where we are. You might not have the direct means of preventing it, but we need to create awareness to how it presents so people can speak up early. Now, one of the problems with fibroids is that people don't know, and they present very late when it's causing problems. So we need to, for our ladies, try to encourage diets, rich diets, lots of vitamins, lots of green leafy vegetables, if that works. We need to increase surveillance. We need to, if you've had a history of that and you're having these symptoms, we need to speak to the women to speak out and just have an investigation, have somebody put his hand on your belly or the doctor put his hand on your belly to have a feel and examine and do a scan. A scan of the belly is not very difficult. So those are ways we can increase awareness and try to get the diagnosis right. Talk to women about the signs. If you're bleeding heavily, it's not meant to be that way. Some people, because they've started their menses at 15, 16 and have been bleeding heavily and throughout their life, they think it's normal. Sometimes you just have a fibroid there just causing you the symptoms. Good, healthy lifestyle, increase awareness, increase speaking out, just speaking to your doctor if you have any concerns whatsoever with regards to all the things we've spoken about, all the signs and symptoms we've said of things that could happen. Speak out so it's diagnosed early. That's should be one of the main ways of preventing it.
Thank you. Thank you. You can jump in. You can jump in, Helen, if you wanted to
Okay,
add.
thank you.
Yeah.
So one of the awareness we can create is, one of the things we're doing right now is creating an awareness to people to let them know about uterine fibroid.
Yeah.
And one of the things I do know is like sharing your experience, for those that have had that in the past. And another thing is like we have these days we have social media. A lot of people do everything on social media. So creating awareness is not just talking about it on like a platform like this. We can create awareness like designing a poster, letting people to sensitize people to know more about it and how they can prevent it, what they can eat, especially their diet intake, and how they can see the doctor about it when they start experiencing the symptoms and signs of fibroids. And I think July is uterine fibroid day months, if I think so. So part of it is like to come out to people, to let people know about more about it, because I know a lot of people are lost, they don't know much about this fibroid itself. And talking about the prevention, we said it earlier that the cause of fibroid, the uterine fibroid is not unknown, but prevention may not be possible, but at some point we can, like a little percentage of the tumor can be through the intake, the diets, living a healthy lifestyle, can, eating healthy. And one of the things I do discover is like, if you eat garlic, they said garlic also reduces the fibroid, because it's a natural thing. So when you eat garlic, it helps a lot, and the anti-inflammatory properties can destroy the growth in the tumor, according to the research. So eating eating diets very well, taking notes of the diets, especially calcium, adding calcium into the diary is very, very okay. This prevents it to some level, but it cannot be prevented at all. Like, the cause is not unknown, and the little way we can prevent it is to reduce the tumor by eating good diets. And all these things will help to reduce it to some level.
Yeah.
Thank you. Thank you for sharing that information. I'm sure that information is useful. Dr. Adama, you wanted to add to that?
No.
Okay.
I was quite impressed with the new findings about garlic. I never knew about that. So
Yes.
that's a good thing today. I'm just learning that. Yeah.
Thank you. Thank you so much for sharing. So we move on to signs. I know we talked about the heavy bleeding, the pain during intercourse, but are there any other signs of uterine fibroids? And how can women, or when should women get tested for uterine fibroids? I'll start with you, doctor, and then I'll come to you.
Okay. I thought you wanted to start.
Oh, if you want to go, you want to go first, Ms. Crown?
He's a doctor, let it go first.
Okay.
So the signs are usually as a result of the symptoms that she had, whatever the fibroid is causing. If you remember, I said one of the major signs is heavy bleeding. So imagine you have a tap that's open and you have a tank with water and you keep bleeding. First thing is that your water level is going to come down. Okay. So what we call that in medicine is anemia, low iron level. She had said that. So low iron level. And how will the woman know she's having low iron level? She gets tired easily. Little things that she does before she starts getting so tired easily. And this could happen around when she's having her menses or shortly after she's had her menses. She gets tired easily. She's bleeding excessively. You're soaking through 3 or 4 sanitary pads, heavy soak sanitary pads. You're having heavy clots in your menses, just coming out as clots. And then all of a sudden, after that, you feel very, very tired. You can't walk a short distance. You can't climb the staircase without catching your breath. Occasionally, you feel very dizzy. Sometimes you feel your heart beating. We call it palpitations. And then you have to lie for a while. And that happens every time after your menses. You need to go check that. That's one of the signs of uterine fibroids or a complication of uterine fibroids. Also, because it's a tumor, it's a mass, okay? A mass occupies space. As it keeps growing, it's a firm mass, so you can feel it. So if you feel your belly, the lower part of your belly, sometimes it extends to the upper part of your belly, just around the belly button and downwards. It could feel kind of like a hard mass. If you feel something hard there, it begins to raise suspicion that there's something there. And if your doctor examines you, has kind of like an internal examination or just has a feel of your belly, they can feel a mass there. That's one of the things that could be a sign of uterine fibroids. Next, because it's a mass, it's occupying the uterus where a baby should form. So a woman who's struggling to get pregnant, despite everything she's done, she's menstruating, she's having everything, could that be a sign of uterine fibroid occupying space? So it's just occupying the space where a baby should form, causing problems for the sperm to reach her eggs or something. So she needs to check. Those are things that we could look out for. Now, she could have recurrent infections. Recurrent infections because the womb lies just behind the bladder, which stores our urine. Now, if you press on the bladder for so long, it means she goes to pass urine, she doesn't empty completely, and then she starts having recurrent urine infection because the urine is staying in the bladder for too long, and that's a very good medium for infection. So if she keeps having recurrent infections, she's having a mass, she's feeling very tired, she can feel her belly, her mom has had fibroid before, those are signs that will point towards uterine fibroids. Sometimes a woman might be pregnant, she might get pregnant and then having severe pain in pregnancy and she's not in labor. That could be a sign that uterine fibroid is there, because one of the changes with fibroids in pregnancy could be the red degeneration, which will cause severe pain. I recently just saw a patient with that a few days ago. Another thing is that a woman might get pregnant and then she goes into labor before she's meant to go into labor, and she's not had a scan before. Those things could point towards possibly maybe a uterine fibroid. Or she gets pregnant and in the first 3-4 weeks, every time she's miscarrying. Obviously, it's because there's a mass there occupying space where the womb cannot get big into. So those are the basic signs that women should look out for, which could point towards having a uterine fibroid.
So I'll add to that straight away. Another signs we could look out for is frequent urination. When women start urinating more than often, going to toilet to wee, these are part of the signs that need to be looked for. And sometimes could be like difficulty to empty the bladder as well. These are part of the signs that need to be looked for. And the third one is a long period. When women start having long period, I can remember those days in Africa when someone, I think a lady that I knew some times ago, used to have a period for 10, 12 days. So it was recent I started understanding why, those days, why this was happening. So I think these are part of the symptoms, signs that needs to be watched out for, like when ladies or women start having longer period, when you're supposed to have a period between like 3, 4, 5 days, then you start having more than 5 days, extra 7 days, 10 days. These are big signs that need to be watched out for. When a lady or woman start having this is when you need to speak to the doctor, and this need to be checked before it gets bigger, the tumor gets bigger in the womb.
Yeah.
Thank you. Thank you so much for sharing those signs. I just want to go over a few of them that I was able to capture. That is the hard mass in the stomach, difficulty with pregnancy, difficulty getting pregnant, heavy bleeding. I don't know if it's during the period but just heavy.
During her menses, heavy bleeding. And sometimes she could bleed in between her menses. We call it intermenstrual bleeding. Say her menses is 30 days, and then she bleeds for 5 days, and then day 15 she bleeds again, and then day 30 she bleeds again, just erratic bleeding. And that could point towards having uterine fibroid, especially if she's Afro-Caribbean.
And there's frequent urination.
Yeah.
And long extended periods.
Yeah.
Because typically it's like 3 to 5 days during that. Yeah. So these are some of the signs, and if you find yourself with some of these conditions, you should see a doctor.
Yeah.
Yeah.
I would say it mustn't. Yeah, it's good to see a doctor, but if you can see an experienced nurse or an experienced health practitioner who's experienced with women's health, because you don't want to say you must see a doctor, and if they don't have a doctor available, they get missed. So basic things. There are some areas where you can have a specialist nurse who's into reproductive health, who could also make diagnosis. Or if you cannot see a doctor, just go get a scan, a belly scan. It's as simple as that, and that gives you the diagnosis of uterine fibroid or not. So if you find it difficult to see a health practitioner, just go look for somewhere to have a scan. Although we don't medically just say go do a scan and come and meet the doctor, I have fibroids. But my reason for saying that is if it's kind of like a low resource area where you barely have medical doctors, don't die in silence and say, no, I cannot, I don't have fibroids. Just see somebody, get somebody to put hands on your belly and say, oh, there's something hard there, then do a scan. That tells us if it's a fibroid or not.
Thank you so very much. And so I'll get to additional comments that you would like to add as we wind down to closing the session today. Are there any additional comments that you would like to add? I'll start with you, Dr. Adama, and then come to you, Ms. Crown, if you want to add any additional comments that you feel is appropriate to share. Feel free to share. Thank you so much.
From my point of view, it's one thing to diagnose uterine fibroids. It's one thing for people to do that. Yeah, we can diagnose uterine fibroids. Oh, you have the uterine fibroids. The next question is, what are we going to do about it? Yeah. So it's going to be like, yeah, okay, you have uterine fibroids. What am I going to do about it? And so that's where we come in as doctors, as health practitioners, creating awareness. You can either do nothing. Okay, if it's not causing you any problem, the best thing in life is to do nothing medically, do nothing, do no harm. So if she's having bleeding and she's tolerating the bleeding, she doesn't have a firm mass, she gets pregnant, she has a family size, she's not getting any infections and everything, fine and good, you just leave it at that. If it's causing symptoms, then we can decide to treat. Okay, we can have conservative treatment, which is using medicines to try to reduce the effect, not reduce the fibroids, but reduce or help and improve the person's symptoms or quality of life. And those are medicines that can help with reducing the amount of bleed. Okay, so if a woman's problem with fibroids is she's bleeding excessively, we try to give some medicines that will help reduce the amount of bleed. We don't jump in to do operations all the time. If a woman's problem is pain, we'll treat the pain and treat the bleeding. If a problem is that the fibroids are growing excessively so big and causing problems, then we can have a discussion to say, what should we do next? But we usually will start from the basis, do nothing, observe, treat the symptoms. And if it's not working, then we go into having operations. That's where we offer operations to do, to treat fibroids. Basically, the treatment of fibroids is to take it out. If it's causing symptoms, if it's causing problems, you take it out. Some theories have come out to say some things will shrink it and disappear. I haven't seen any in my career that if fibroid shrinks and disappears. But there's some treatments that we can give that will reduce the size of fibroids, and sometimes you could pass into the womb and get expelled out of the womb. And that's usually some surgical techniques we do to stop the blood supply to the fibroids. Once you stop the blood supply, it dies off. And sometimes it could just disappear and come out medically. Sometimes we use pills, contraceptive pills. If you remember, I said the major thing that we think about fibroids are hormones. So if you're able to control the hormones, create a balance between the hormones, then you might be able to reduce the size of the fibroid or avoid it from growing bigger or having more fibroids. And sometimes your doctor might offer you a hormone intrauterine contraceptive device or system, which is called the Mirena. It contains the hormone level testosterone. What that does is it tries to reduce, it balances the effect of the hormones on the lining of the womb, reduces bleeding if you have fibroids in the inner lining of the womb, which is usually what causes the most amount of bleed for women, because women bleed from the inner lining of the womb, not the muscle layer, the inner lining. And when you have a fibroid there, they bleed excessively. So if you have a fibroid there and bleed excessively, sometimes we just put a hormone coil there just to reduce the amount of hormones there, and that helps solve her problem. So those are the things we will do medically if need be for fibroids.
So to add to what Dr. Daniel has said, and to end it up with the effects of uterine fibroid, I think I mentioned this earlier that the fibroid do not usually cause a serious problem, but the serious problem not talks about the long-term effects on women generally. But the knockdown that it does on women, the low quality of life and causing anemia and all the things that we need to watch out for, to prevent it when we look about the prevention, so to say. So when this is left untreated, all this can cause a problem and a knockdown and effect on women generally about their lives, and creating awareness and preventing it at the earliest stage, when you don't allow the tumor to get bigger in size, in the, preventing it and doing all necessary things and treating it as doctor has said, if operation is needed for it, when it has a bigger size. So that's what I can add at the moment. Thank you.
Yeah, thank you.
Thank you so much. And further, I'm going to dig a little bit deeper before we close, just to find out if there's any other additional comment that you would like to add.
Nothing
For
from me.
me,
I think.
sorry.
I've
Okay,
said
go on.
No, nothing from me. I think I've said a whole lot of medical jargon, so I think I'll just.
Yeah, what I would like to say is, as a woman, when we're talking about infertility and what uterine fibroid is causing in the woman these days when they are unable to produce, when we're talking about infertility. So for creating awareness, this is my area. Like I try to let people know much about it, especially people that are still looking for the fruit of the womb. Knowing much about this area is very, very vital for those that are looking for the fruit of the womb, taking necessary precautions, preventing it, and keep going for treatments when need be, when you have it. And as Dr. said earlier, when we talk about this, this tumor getting bigger and women cannot produce children or cannot, the first thing they need to do is to go to see the doctor. And if you're in an environment or a community where you can get a doctor, like Africa, you can as well go for ultrasound to at least to know the first thing, that if it is that the tumor and how big it is and how you need to get it treated as quick as possible. That's for women out there. So creating more awareness on this will help our women to know more about it and how they can go for the treatment as well. Thank you.
Thank you, Ms. Crown. Go ahead.
To add something, yeah. So just since you're creating awareness, I'd just like to finally add to say, it's not all fibroids that must be treated. Okay. Yeah, you might have a fibroid. It might be 4 centimeters, it might be 5 centimeters. Those are usually very, very small fibroids. They don't need to be treated. Above 10, 12 centimeters of fibroid, well, people will go to scans and say, oh, I have a fibroid. This sonographer said I have a fibroid. Doctor, what should I do? Operation. No, it's not every time you need an operation. There are several ways of managing fibroid. So people should not be scared when they say, oh, you have a fibroid. Don't be scared. It's not always going to end in an operation. we might do nothing. We might just help you improve your quality of life. It's not always having surgery. And that's something that's a take-home message I want people to know. It depends on what happens. Depends on, just have a chat with your doctor, have a chat with your family doctor or whoever, or go on the internet and look at treatments of this thing and have a chat with your doctor. So you can look for ways to make your quality of life better. That's the final thing I would say. Yeah.
Thank you so much. And you both mentioned some very, very key, very important points. And I'll go to you first. Helen, when you talk about, this issue with infertility and the importance of really honing in on really how the condition is impacting you, and responding and going in and checking in and seeing, what's going on with your body. And you also talk about how this issue is important to you, and you highlight those health issues. So just want to thank you so much for sharing that, because there are people who are impacted by those things. So it's very important to be, there are people who is impacted by this condition. I'm sorry. And so it's very important to be aware of, what's going on and how it impacts the body. And you also talk about your passion, Dr. Adama, in moving in this area in gynecology. So, this is very important. You talk about, wanting to care for women and the babies. So this is a very important topic for those who are impacted by infertility as well. So I want to thank you for joining us today and taking the time out. What time is it? What time is it, y'all?
Yeah, it's just 7 o'clock now. A few minutes to 7 p.m.
Thank you. I think we have a difference between us. We have a difference of 5 hours.
Yeah, I think so.
Yeah.
I think so.
I want to thank you for spending your time with us today and sharing this very important information, especially in our community as it pertains to Afro-Caribbean. I'm so happy to have you here to collaborate with you, Miss Helen Crown, Divine Mercy UK. Thank you.
Thank you. You're welcome.
So happy to have you a part of the session, and Dr. Daniel Adama, if I'm getting it right.
You're always right. You're always right.
I was almost there, but I still have it wrong. I'm a little bit off, right?
No, I think you got it right. It's better than what some other people will say. So, yeah.
Awesome. Thank you so much. And
Thanks,
for those persons, thank you. And I know persons, they may come on, they may see the session, afterwards. Yeah. So you can add your comments to the video if you have any questions. But I want to thank those who popped in and who joined us today. Thank you so much. So I want to thank you for listening to our talk. I would like to thank our guests, Helen Crown and Dr. Daniel Adama. Oh, you want to share your page? You want to share your page?
Yeah, on my page, that's Divine Mercy Vision UK. And about this uterine fibroid, I'll be having Dr. Danny again on the platform that was July. We'll be creating more awareness. That will be second week in July. We'll be creating more awareness on uterine fibroid, so you can join us too on that page. That's Divine Mercy Vision UK.
Awesome. Thank you so much. I would like to thank our viewers for listening in. Like our page for future notifications of upcoming talks. Comment under our videos. Let us know your thoughts and let us know what you want us to talk about. You can also subscribe to our YouTube channel, Can We Talk? Follow us on Instagram and Twitter using the addresses provided on our page. And remember, let's think, talk, do. Thank you so much.